Dr. Ariel Perez. I am the medical director and founder of Immunotherapy Institute here in Tijuana, Mexico. And today we're here to discuss some things about cancer, to answer some questions that are the most common ones and typically asked by many patients. So we want this opportunity to be live and to have these discussions along with you. Feel free to join and to ask any questions that come across. We will answer them as the best that we can. So thank you again, and let's start.
So, common question, doctor. People might not be aware of all the cancer treatment options available to them. What are some of the options that people might be missing out on by just focusing on traditional methods?
So the traditional method is something that we can rely on as a one-size-fits-all, in which we limit the treatments to pretty much three major things, which is chemotherapy, radiation, and surgery. Right? And cancer is not a one-size-fits-all, doesn't correspond to a one-size-fits-all. So the number one different-wise, treatment-wise, will be to personalize, to approach this from a more personalized perspective. Second, availability of the most advanced technologies. Immunotherapy right now is the most advanced treatment. So there's another advantage there or difference in relation to treatments that are not available, traditionally speaking, right? We need to go through different steps in order to reach those points. Another treatment could be the integration of the rest of areas that cancer is also embedded with. So from genetics, nutrition, environmental medicine, immune system, psychology, right? All of these areas participate in what we call cancer, and they need to be addressed, and they also need to be intervened. So that's a little bit of the different areas and interventions that patients are not getting in the, let's say, traditional approach. Right?
Excellent. We're getting a question from Nicholas John Gleski. The question is, do you have good results with stage 4 small cell carcinoma?
Not small cell carcinoma, small cell carcinoma?
Yes.
It's not small cell.
Small cell.
Small cell carcinoma. So thank you for that. And okay, the results of a given patient is not necessarily attributed just to us. When we say stage, we are discussing a patient that has cancer in the main organ. Let's say right now in the lung, small cell carcinoma, and in a distant organ. A distant organ could be the liver, could be the brain. So that doesn't say anything about the patient. It's just telling us a quick reference between us physicians that, again, I have a patient that has cancer in the primary area and in another area. So when we say really saying anything besides that. So can we help? Yes, we can. I think what people refer as stage 4 is when we're dealing with patients that have cancer, but also now are dealing with complications of cancer, complications of the treatment. That's what people, I think, envision more as a stage 4, this patient that has been through a long journey, a lot of issues, and in many cases it's seen as the last stage, which is, again, is not necessarily the case. Stage 4 is just a quick reference. So the results that we have here are very positive because, again, we're working through a personalized approach in which for those patients that come here already with complications, either from the treatment or from the disease, are immediately treated. We do this typically, unless it's putting the patient's life in jeopardy. That's when we work against some of these things. But typically the patient is not stabilized, so he can continue, in this case, with treatment. So the success that we have with stage 4, but in this case, not just small cell, any form of cancer, comes from the fact that the treatment is aimed for that individual, for those circumstances, working against those complications, and also respecting the most important thing, respecting the quality of life. Don't be aggressive.
Okay, so in other words, yes.
Yes, of course, and we have high success because of that. I think it's important not just to leave it in yes or high, so we can explain why we're achieving these results. Right?
Exactly. The question that
he was asking if we know a place that treats pediatric, and unfortunately in Tijuana there's really no place that deals with an integrative approach when it comes to pediatric patients.
That's a very complex topic. We have been approached by many people asking that question, and as far as we know, we don't know any place. We don't. Why? It's a big topic that has to do a lot with parents, and and that dynamic that represents a child with complex. So no, we don't know.
Okay,
I'm
so
sorry
let's keep
that we
going
couldn't
with the.
be of help in that sense.
No, it's a perfect question. Perfectly understandable. Um, when we're talking about cancer wait times, some people in the U.S. and Canada might be putting their health at risk by having to wait for cancer treatment. Can you elaborate a little bit about this and perhaps explain why people don't have to wait for cancer treatment here in Mexico?
Sure. So the systems that have been, and we're going to discuss the most, the system that we typically work with from the patients that we receive. Canada, the states are the biggest. The states, insurance companies, or the insurance is the way in which the medical system works and medical services are provided. And in Canada is through the social system. Uh, both are systems that are being decided by a third party, right? So in relation to the insurances, sometimes is being approved for that patient in a that requires to wait, right, unnecessarily. And the other, for instance, in the social system will be the fact that there's no appointments. There's no appointments. Sometimes you don't have access to the treatment immediately and you have to wait months. The disease doesn't wait, right? So here we remove those locks because we don't work with either the insurances or we don't work with the social system. So this removes any of these locks. So now it's a relationship between you and your physicians or your doctors, in which now you have access to whatever you need. And there's for an example. We do a CT scan or a PET scan and in the results in an hour, which typically, at least in the States, you need 2 weeks or a week at least to get the results, right? And just a result, maybe not an interpretation by your doctor, which here again comes with the interpretation by your treating physicians. So that's pretty much the differences and advantages of why the waiting period, right? Again, it's just that we don't have these locks, so that's the reason.
No locks, unlocked.
Mhm.
Okay, perfect. As far as side effects of chemotherapy, the question is, what are some of them and how can
We're back. So again, we were answering about the most common side effects of chemotherapy, which we already mentioned: nausea, vomiting, lack of appetite, gastrointestinal issues, changes in the way the food tastes, also fatigue, very common fatigue, hair falling down. That's some of the side effects that are most common ones. Of course, there's more and sometimes even severe side effects. Neuropathy, for instance, another one, very common. The famous chemo brain is an example. So again, many things. And how can you work against this? Well, first of all, as we have been discussing in many of our videos, it's not just in this day and age, it's not just about chemotherapy. Now we have access to other modalities of treatment, immunotherapy, medications, immunotherapy with cells. So there's other options that we can rely on or can be used in conjunction with to have more effectiveness, but second, to decrease the aggressiveness behind the treatment. So the question here is, can we use these technologies without being aggressive or sacrificing the patient's quality of life? And the answer is yes, we can. But we go back to stopping the one size fits all and focusing on the individual. It's not the same to treat a 30-year-old to treat an 80-year-old. And it's not to say that the 80-year-old cannot be treated. So because you're young, this means that you can sustain or tolerate aggressive treatments with chemotherapy, right? Or not because you're older doesn't mean that you cannot be pushed a little bit more. So again, it's about an individual approach in which we need, if, before engaging, right, before treating, we need to ensure that the patient is in the best condition, let's say. And when I say condition, of course, we're talking about a patient with cancer. So what I'm trying to say is we're going to engage, a certain treatment is going to be used that comes with things that we don't want. And the question is, can we do something about it? Can we help the patient? Can we protect the patient? And the answer is yes, we can. So again, don't start the treatment if the patient is obviously in bad conditions, malnourished, or has complications. Therefore, they need, as we were discussing, to stabilize first. So now you can work under different circumstances. And this could represent working with nutrition, emotional areas, again, everything that we have discussed, but also to modify the main regimen to avoid that. I don't like to use the word low dose chemo because that means that, again, we're fractioning just the medication for those purposes, and then where's the efficacy, right? So no, again, it's the modification so you can achieve the response that you need, yet avoid the side effects or complications with it, which again, it can be done, but not with 5-10 minutes with the patient. This is about getting to know your patient so you can individualize.
Okay, thank you for that answer, doctor. And also, when we're speaking about the cost of that differ when they come down to Mexico. Porque ahorita.
Okay, we're back. So we're talking about the differences between the financial experience between other countries and here. And yes, the treatments that are typically used around the world, right now talking about immunotherapy being the most advanced, it's something that is completely out of reach without any insurance or the social system in these countries, completely out of reach. We're talking about thousands and thousands of dollars. An example will be, we have heard of treatments with CAR T therapy that go beyond $700,000, right? And you can receive that treatment here, again, in certified centers, certified procedures, with a lot less of that. I'm talking about less than $100,000, even less than $80,000. So again, it's an example, and I'm not the best person to talk about numbers because that's not my area. But there's definitely an enormous amount of difference when it comes to the financial experience being treated in Mexico versus being treated any part of the world in a first world country wise, right? Better access to treatment for a fraction of a price, right? And again, life doesn't have a price, but when it comes to facing these kind of conditions and these kind of problems, definitely it's important to consider. And many people don't know this, but we as physicians have the responsibility to take also control or help patients in relation to the financial burden. Why? Because cancer affects physically, emotionally, socially, and also financially. So we need to help patients plan. But because there's the insurance, that doesn't happen. So here again, something that we consider a lot. It's a journey that we need to work together. So we need to think about all of these aspects. And the bottom line is here, thanks to the different, what would be the word? The different capacities that we have to get medications at a completely lower cost, these treatments are more accessible. And we're talking about the most advanced technologies right now.
Excellent. Thank you so much for that answer. Another question, common question, is how do I prevent breast cancer from coming back?
Well, there's no one size fits all again when it comes to preventive medicine, but we need to first acknowledge why the patient got here, right? Because we don't explain this to our patients. You have cancer, and then here comes the treatment for cancer. So everything is from this point forward. But again, the question is, why am I here? Why do I have cancer? And we typically say, well, genetics. Now we say environment, and it's something very vague. But the reality is that we can be precise. Again, we have mentioned that cancer has its root causes in genetics, nutrition, environmental medicine, immune system, and psychology. So how can we prevent a reoccurrence? By acknowledging why the patient is here, by detecting in what we know cancer is embedded with, what we can find. Acknowledging these differences, acknowledging these inputs is going to allow us to see or to interfere in those possible inputs and to stop the possibility of a reoccurrence. Of course, take control of the patient's, know the patient's genetics, right? Control of the patient's nutrition, control of the patient's environment, or acknowledge of the environment, potential problems there. Of course, the work with the immune system being one of the most important systems when it comes to the part of cancer management. the psychological support, and of course the areas of concern, right? So by working with the individual, by acknowledging the different inputs that these individuals have in their life, and it's not a flat behavior. What I mean is whatever aggravated the disease 10 years ago not necessarily is the same thing right now. So this becomes a dynamic exercise between the doctor and the patient, in which we need to always look within your lifestyle what could be a possibility here, but also by covering the responsibilities that we have of maintenance and the responsibility as humans of taking control of our health. But that will be the best answer from a general perspective. Of course, we can discuss key elements like, for instance, ensuring that patients have vitamin D levels in optimal conditions, for instance, right? But from a general perspective, I would say these are the most important things to consider.
Thank you. Another question that we have is, can exercise help with cancer survival?
Absolutely. Exercise is, to this day, and continues to be the miracle drug. Exercise makes our bodies work. We are beings of movement. We have an organism that requires that we move. But because of the social structure and economic structure that we have created, in which now all of us need to be sitting for hours upon hours, the movement is really a secondary thing, right? Now it's a luxury to exercise, but it's a necessity. And the problem is when this necessity comes in the form of, now I have cancer, so now I have to exercise. Of course, that's why it's important to talk about the benefits of it. But now I have the disease. Can I benefit from exercise? Absolutely. This improves cardiovascular function. This improves immune function. This improves circulation. This improves lymphatic response or drainage. So there's many advantages that it comes to has to be always done through the. Okay. We're back. So we're talking about the importance of exercise in cancer. So we're explaining that indeed it's very important. We have discussed the advantages that we can achieve through exercise, cardiovascular benefits, lymphatic benefits, immune benefits, of course the muscles, bones, but there has to be always through medical surveillance, right? So we don't push the patients too much, right? Or the exercise is truly beneficial and doesn't become also a problem, right? Because at the end, exercise is stressing the body, but in a good way. But again, in a situation such as this, we need to be careful of how we're going to push our patient or what type of exercise the patient can benefit from. But absolutely, it has to be part of the treatment, not just for cancer, for any kind of problem.
Makes sense. The last question that we have, and then you can start concluding and adding anything you want, is what follow-up tests should I do after cancer remission?
So the word remission means there's no evidence of cancer, and this is achieved or this is declared when we have the tests that we run, which are imaging testing and blood work. CT scans, MRIs, PET scans are the most common ones. And these tests, along with blood work, need to show no evidence of disease. That's when we use the word remission, and that's when we have achieved, in this case, a status free of cancer. That needs to be done afterwards. We already discussed the things that we can do to prevent, how we need to be on top of health, but in relation to testing, at least, and depending on the type of cancer that we're dealing with, depending also on the behavior of this cancer in the patient that we're discussing. But from a general perspective, we can aim for a 6 month after remission evaluations every 6 months, right? Every 6 months, in which maybe after the second year, we can now space it to every year, right? But here, and that's the traditional I would say follow. Again, images and blood work. Here, we promote a more close relationship with our patients. So we continue to be part of their daily lives, so we can also intervene in a more early, in an early moment by maybe acknowledging that the patient, as sometimes they say, I fell off the wagon, for instance, when it comes to my diet. All right, so the patient acknowledges this, share this information with us, we can intervene, opposed to now we have the problem again. Now it's a serious problem, and now maybe this has had some repercussions in other areas. So communication in our programs is vital when it comes to follow-up. It's very important for us to continue to see how the patient is living their life based on recommendations that have been done based on the analysis again of their life and all these things. So I will say that the follow-up, it consists on the same testing that is done in the oncological field, images and blood work, but in our case also comes with a constant surveillance directly with the patient's life. Right?
You want to conclude perhaps with an invitation for people who might be interested in getting to chat with you personally about their specific case?
So absolutely. First of all, thank you for joining us in this live stream, our first one, but not our last one. And again, we are asking for us to visit our website and follow us in the different social medias platforms that we have, so you can have more information about not just us, but also these different topics that we're covering. And if you want to have a one-on-one consultation, just visit us in our website and Immunotherapy Institute, so you can schedule a phone consultation, and we're here. So thank you again, and hope to hear from many of you soon.